Congressman Mike Pence of Indiana is the chairman of the House Republican Conference. Good to have you with us, Congressman.
Thanks,
welcome.
Martha.
So what does all this mean? You know, what actually came out of this bill, and what does it mean for Americans across the country when they look at their health care?
Well, we'll see. Right now, we know that the powerful Energy and Commerce Committee is going to be convening in a couple of hours. There's supposed to be a deal, but it sounds like a pretty bad deal for American taxpayers. Up to this point, House Republicans and a handful of conservative Democrats had taken a strong stand against a government takeover of health care, which is all about government-run insurance. And at least what we're hearing about this deal is, while they've trimmed $100 billion here and they've changed the impact of taxes on certain businesses, at the center of this so-called deal is a government-run insurance plan that will cause tens of millions of Americans to lose the insurance that they have and vastly expand the role of the federal government in our health care decisions. So
in terms of the public option, it's in this plan. They say it's voluntary. What we're hearing on the Senate side is that the public option is dead, which is true.
Well, we're focused on the House side, although I'm a little skeptical about the talk about the public option being dead in the Senate. You know, last month, the Senate Majority Leader, Harry Reid, actually said, I don't care what you call it, co-op or something else, it's all a government-run plan. So, you know, what you're seeing here, if the rumors are true, is that the Democrats have tweaked around the edges the launch of a government-run insurance plan. And even though, you know, this administration and House Democrats continue to insist that people will be able to keep their insurance, common sense tells you otherwise, Martha. I mean, in this difficult economy, when companies are struggling to keep the lights on and the doors open, you know, as soon as the federal government's offering free health insurance down the street, millions of Americans are going to be told by their employers, we don't offer health insurance here anymore.
We're tight on time, Congressman, but I want to ask you one quick question. So in your mind, a co-op is equal to a public option, or is it something different?
No, I'm quoting Senator Harry Reid, who said,
what do you
I'm
think?
paraphrasing, a co-op. Well, it really depends. I mean, if you're talking about a co-op that looks a lot like Fannie Mae and Freddie Mac, then it's just all kind of the same thing, pulling taxpayers into subsidizing directly or indirectly a health insurance product for Americans. Republicans and most Americans know we need to lower the cost of health insurance, lower the cost of health care. We can do that by strengthening and increasing the choices within the private insurance marketplace, not by launching a government-run plan with $1 trillion in higher taxes, which it looks like the House Democrats are intent on doing.
All right, we know you're working hard on this. Congressman Mike Pence, Republican from Indiana, thank you very much, sir. Good to have you with us.
Thanks, Martha.